So now we're just looking at his biceps muscle. We're at 1833. Right side of the screen is lateral. You see that pretty large biceps muscle, kind of in the midpoint of his muscle. 1833 again. Now we're going distally.
Here you can see the layering, big biceps muscle on top with the tendon that just looks like a little sliver kind of swirling through the muscle. And underneath that you have the thick brachialis muscle.
See the biceps muscle now forming that tendon. You got the brachialis muscle.
Now you're going a little bit distally, and you could differentiate between the long-headed and short-headed biceps muscle.
Now you can see that basically biceps is just...
Here you could differentiate two essentially spherical type tendons of both the long head and short head of the biceps muscle. Here towards the right you can see that large brachioradialis muscle, and in that oblique fascial plane lives the radial nerve that branches into the deep and superficial radial nerves. So here again, most of the muscle now is essentially brachialis muscle, and you have the two biceps tendons superficial to that.
Let's see, coronoid fossa, and 6. I'm going to go up on my depth now, just to get a artery.
Here again is your home base view. You can see the fat pad within the coronoid fossa, pronator teres muscle all the way medial, and again you have brachialis muscle making up that thick muscle overlying the distal humerus.
38 again, so we're starting pretty high up on the arm.
Here we're focusing on the vasculature and the median nerve. Here the median nerve is just on top of the brachial artery.
And now I'm just going to go distally. We're going to follow that median nerve.
As you go distally, the median nerve essentially goes medial to the brachial artery, and you can see here it's just a touch medial to the brachial artery. You can see the surrounding brachial veins, and even medial, more superficial, is the basilic vein. Here we got some color Doppler. We're looking at the brachial artery. And again, here you can see that median nerve just on top of the brachial artery. You got the brachial veins on either side of the brachial artery. All the way to the left, you see that large basilic vein. So here again, now the median nerve is medial to the brachial arteries, go distally over the elbow joint. And now we're going even a little bit more distal, and you can see how that nerve kind of dives down, going underneath that pronator teres humeral head.